so we can get our attendees joined. All right, looks like we have a few more people joining. Wonderful. Fantastic. I'm going to give it another 30 seconds while we have everyone who's here join us, and then we'll begin.
Okay, sounds good.
All right. Okay, I think we're ready to begin. So
Yep.
I'll start by just saying welcome everyone. We're so excited you could be here with us today. We have a fantastic speaker today. Before I get into her bio and kick this off, I need to do a little bit of housekeeping. I'm going to go ahead and share my screen here. So for compliance purposes, we have legal and disclosure information on this slide. And I'd like to add that Insurance Systems Group, Rodika Koloda will be speaking on behalf of them, and Plan Financial Services are separate, unaffiliated entities, and that the views represent those of the speaker and not of Plan Financial Services. All right, gotta get our basic disclosures out. We're going to be taking your questions at the end of the presentation. You'll just select the chat feature and enter your questions at the bottom of the screen. And while I have this up for just a moment, I'd like to step into introducing today's speaker, Rodika Koloda. Rodika is a life and health advisor at Insurance Systems Group. She has over 20 years of insurance experience, with 16 of those years focused and specializing in the senior market. As a broker, Rodika not only has extensive knowledge in the Medicare market, but because she is appointed with all insurance carriers, she is able to discuss and explain all available plan options and know how they best suit the insurance needs of each of the clients that she services. She's been a fantastic resource for us here and for our clients at Plan Financial Services. I'm going to give this about 15 more seconds up here of the legal and disclosure information, and then I'm going to turn it over to Rodika, and I'll make you the host, and you can begin your presentation.
Great, thank you.
All right. All right, it's all yours.
Okay, great. So give me a minute here and I will share my screen. We want to get back to the first page. Okay. Hopefully everybody could see that okay. So we're just going to get into, thank you, first of all, for taking time out of your day to join us. Hopefully you will be able to get some good knowledge out of the basics of Medicare. So again, like we had said, I'll go through these screens and share the information as they are shown. And then any questions as they come up, please feel free to put those in the chat. We would love to be able to make sure that you walk away today with more of your questions answered than not. So we'll just start going through all the different basics. We'll cover many different topics: what Medicare is, your eligibility, the difference, like if you're still working and you're eligible for Medicare, and then all of your different options that could pair alongside with Medicare. First slide that we'll get into is just a brief history of Medicare. And Medicare was signed into law by President Johnson in July 30th of 1965. There are currently 19 million enrollees within the first 12 months of it being signed into law. And as of today, there's about 63 million. In 2021, more than 4 in 10 Medicare beneficiaries, which was 26.4 million people out of 62.7 million Medicare beneficiaries overall, are enrolled in Medicare Advantage plans. So there's two different options. We'll go over both of those, but just a quick little snippet to show how many people are currently on the Advantage plans versus a supplement. Notable changes to original Medicare, both parts A and B. In 1972, coverage for those under the age of 65 on Social Security disability were eligible to get into Medicare. Prior to that, they were not. In the 80s is when the supplemental insurance plans were standardized. 1997 is when Medicare Advantage plans were initially introduced into the market. And 2003 is when they actually included the prescription drug plan. Prior to that, Medicare did not cover any kind of prescription drug coverage. And then in 2010 is probably when we had more recent changes to Medicare with the introduction of the Affordable Care Act, is when Medicare started to cover preventative care. Prior to that, Medicare did not cover preventative or wellness visits. And also with that, there was a reduction in the Part D donut hole or the coverage gap costs, and we'll go over that later in the slides. So what is Medicare? It's a federal health insurance program for eligible citizens and legal residents. It is funded in part by your taxes. So as you're working, you're paying your FICA taxes, and that's going to pay for a portion of your Medicare. And it is individual health insurance. So it is not a family plan. It's not a plan for you and a spouse. It's just for you individually. Things to know: Medicare is not free. Medicare is not a family health plan. Medicare is not Social Security. And the last one, which gets confused a lot of time, Medicare is not Medicaid. Those are two different programs. So what is Medicaid? It is a state government program that helps pay healthcare costs for individuals, families, and children with limited income and resources. The programs do vary from state to state, but follow federal guidelines for benefits, and eligibilities varies from state to state as well. Things to know: Medicaid and Medicare can work together. If an individual qualifies for both Medicare and Medicaid, that is what we call a dual eligible. For individuals who are dually eligible, Medicaid and Medicare sometimes work together to cover most healthcare costs, and individuals who are dual eligible can often qualify for special kinds of Medicare plans. So Medicare eligibility. So who is eligible? A U.S. citizen or a legal resident who has for at least 5 consecutive years, including the 5 years just before applying for Medicare. That's a whole mouthful. So if you're a legal resident, an individual that came from another country, as long as you have that legal resident status for 5 consecutive years before applying for Medicare, you would be eligible. And you typically age 65 or older. If you're under the age of 65, you have to have a qualifying disability. And then the last factor is, regardless of age, if you have been diagnosed with end-stage renal disease or ALS. So what happens if you're still working and you have Medicare? Check first, but generally Medicare enrollment could be delayed past age 65 without penalty. If your employer has more than 20 employees, your employer plan, and if your employer plan is considered credible. So if it's not considered credible, your employer will have to advise you of that. If it is over 20, you have more than 20 employees, you technically can delay enrolling into Medicare because your employer plan is primary, which would make Medicare secondary. And then on the opposite side is if you work for an employer who has less than 20 employees, you will still need to enroll into Medicare because Medicare would be primary under that situation, and then your employer plan would be secondary. And under both scenarios, you would have to make sure that your group plan is credible. And again, on an annual basis, if it is not, your employer is required to advise you of that. Good to know. You may be able to delay enrollment if your employer-based health coverage is through your spouse, or you may have to enroll. It depends on your spouse's employer and any rules the employer has around covered dependents. So that's if you're, not working, but you're insured through your spouse, or if you are working and, it just depends on how an employer will allow spouses to get onto their group plans. There's a lot of different variants of where if a spouse is working, the other employer will require them to pick up their employer plan. So if that's something that is specific to you, we could dive more into what that would look like if you had questions on it. So what does Medicare cover? Medicare has two parts. Part one is Part A is your hospital coverage. It pays for all inpatient hospital care. And then Part B is all your outpatient. So your doctor and outpatient care services. Medicare Part A, again, is hospital room and meals, care and special units like intensive care, any kind of prescriptions or medical supplies that are provided to you while you are inpatient, anything that's going to have any kind of care that is going to be administered to you while you are inpatient. So lab work, x-rays, surgeries, recovery, all of that is covered under Part A. Along with skilled nursing, hospice care, if you need blood transfusions, part-time skilled care for the homebound after qualified inpatient hospital stay, and then rehab services after a hospital stay as well is covered under Part A. The way that I always like to explain it is if you are in a bed that is not in your home, that is going to be covered under Part A. And then under Part B is something where you have to physically go and seek treatment for yourself. But Part A, hospital insurance, things that are good to know, it's premium free if you or your spouse worked and paid taxes for 10 years or longer. So as long as you have 40 work credit hours, Medicare Part A will be made available to you without a premium. Coverage cannot be denied. Coverage and costs are per benefit period, provides for 60 lifetime reserve days. We'll get into that in a few slides. And you must be admitted as an inpatient for it to be covered under Part A. Part B is going to cover your physician services, outpatient hospital services, ambulance and emergency room, anything like your lab tests, your x-rays, your MRIs. These are things that you are personally taking yourself to go and have these tests ran, and then you're coming home after. Outpatient mental health care, durable medical equipment, outpatient physical, occupational or speech therapy, diabetes screenings, education and certain supplies, and then your annual wellness visit and some preventative services like flu shots. Good things to know about the Part B. There is a monthly premium for most individuals under Part B, and the amount that you will pay will be based on income. Coverage cannot be denied. Coverage is nationwide, including any provider who accepts Medicare. Premium penalty for late enrollment unless qualified for a special enrollment period. So if you do not enroll when you are eligible and you do not have credible coverage at the time of delaying your enrollment, you will end up having a late penalty fee. What things do Medicare A and B not cover? Medicare Part A and B and Part B deductibles, coinsurance and premiums. Medicare Part B excess charges, amount billed over what Medicare agrees to pay. Prescription drug coverage, routine dental, vision, or hearing care, including eyeglasses, contacts, or hearing aids. Long-term care or custodial care, if that is the only care you need. Most nursing home care is custodial care. So we'll get into that as well. Long-term care is different than rehab. And again, we'll get into that in a few slides as well. Care received outside the US, except for certain circumstances. A foreign hospital is closer to your home than a US hospital. Emergency care is covered if you are traveling outside of the US. And then there's amounts of how much a plan will cover, but there are certain things that will be covered under Medicare if you are not at home. Then Medicare costs. Helpful terms and definitions. Premium is a fixed amount that you pay for coverage, usually monthly. Deductible, it's amount that you pay for covered services before your plan begins to play. Copay, that's a fixed amount you pay at the time you receive a covered service. And co-insurance is amount when the cost of a covered service is split with you, usually a percentage. Most of us are used to that 80-20 split, and that's the split among Medicare. I know that under group plan or individual plans, the co-insurance could be different, but typically under Medicare, it would be an 80-20 split. So cost for 2023, the cost for, since we're getting closer to the end of the year, the costs for 2024 have not been made available yet. So we will just review what they are as of today, the cost for 2024. If there's an interest to know what those amounts will be, we probably usually don't get those until like the end of October, beginning of November. So again, if that's something that someone is interested in, let us know, and then we could share those updated amounts when they become available to us. But again, Part A typically does not have a premium for those individuals who have incurred enough work credit hours. For those who did not incur enough credit hours, you can pick up Part A with a premium, and the premium could differ from one person to another. And if somebody needs to know what that would be, we could share those amounts as well. These deductibles and co-payments are just looking at what Medicare gives you, not what your other options are to pair alongside Medicare. So if somebody only has Medicare and you are admitted into the hospital, you have an initial deductible of $1,600. You are responsible for that deductible before Medicare will pay anything. Now that deductible will cover you for the first 60 days of consecutive hospital stay. And that's per occurrence. So if you end up in the hospital 2-3 times in a year, you are responsible for that initial $1,600 before Medicare will kick in. And then looking at the remainder amounts, we will just assume that you are consecutively in the hospital. So if you are in past 60 days and you're going from 61 to 90 days, you'll have a copayment of $400 per day during that time period. If you go past that from 91 to 150 days, that is what Medicare calls your lifetime reserve days. And it'll cover you for an additional 60 days. You'll pay $800 copay per day during that time period. If you run out of those 60 lifetime reserve days, anything past the 150 days of hospitalization, Medicare will not pay anything and you're responsible for everything. Things to note, there is no maximum out-of-pocket limit. So I have clients who will ask, well, why do I need anything more than just Medicare? Because there is no stop loss. You have your group plan, you have your individual plan, you know what the max is that you would incur in a given year should there be a life situation that happens. Under Medicare, there is no max out of pocket. And then looking at the skilled nursing, there is a co-insurance amount of $200. What this slide does not show, and I'll just kind of point it out, is that Medicare will cover for the first 20 days of skilled nursing care, and there's no copay to you for those first 20 days. And then from the 21st day through the 100th day is when you'll pay that $200. And then if you're in past 100 days of skilled nursing, that then turns into conversation of nursing home stay, which is something that Medicare does not cost. So a little bit more information than what the slide provides, but I think is important to know. And then your Part B costs. So again, the premium here is for most individuals are going to pay that $164.90. Again, this is income based. So depending on what your earnings are, and if you're married and it doesn't matter if you file taxes together or separately, it is your joint income that will determine what this Part B premium is. So for some individuals, this amount could be more. And then if you pay a higher premium on this, I'm just going to make this note. We could I'll mention it again once we get to the prescription coverage, but you potentially could pay a higher premium on a prescription drug plan as well. So under Medicare Part B, you have an initial deductible of $226. This deductible is different than the $1,600 under Part A. Under Part A, if you remember, I mentioned that it is per confinement. You're responsible for that initial deductible before Medicare is going to pay anything. Under Part B, you are responsible for this initial $226. Once you satisfy this, everything then goes into a co-insurance split. Medicare is going to pay 20%, you will pay 20%. And then excess charges, if you see a physician that does not accept Medicare, then they can bill you excess charges above and beyond what Medicare allows. And then again, same scenario under the Part B. Something to note is that there is no max out of pocket under Medicare. So whatever you incur, if this is all you have, you are responsible for that 20%. And then additional coverages. So you have different options that you can choose to help pair along with Medicare to fill in the gaps of what Medicare doesn't cover. The first option is a Medicare Advantage plan, which is going to combine both your Part A and Part B into one plan. The slide doesn't show it, but most Advantage plans will also put in Part D as well. There are some Advantage plans that are just A and B, but most of them are going to give you that prescription drug plan as well. So it takes your A, it takes your B, and it takes your D for drugs, and it puts it all into one plan for you. The second option is a Medicare supplement or a Medigap policy. And what that is just, it does what it says. It supplements original Medicare. So Medicare is going to be your primary, the supplement will be your secondary, and then because Medicare does not cover prescription drugs, you then would want to pick up a prescription drug plan to pair alongside it. We'll get into the differences between the two as well here. So Part C, Medicare Advantage, is an alternative to original Medicare, which again combines your hospitalization and Part B outpatient services in one plan. The plans are offered and administered by private insurance companies. They may include prescription drug coverage, and they may include additional benefits as well. Your eligibility, you must be enrolled into Medicare Part A and B. You have all of the Advantage plans are based on your location. So the county that you live in, its service area, and eligibility is not affected by health or financial status. The costs may charge a monthly premium, and terms can change from year to year. So there are many Advantage plans that do not have a premium. There are some plans that do. And then that would be in addition to your Part B premium. And then with the Advantage plans, there's an annual limit on your out-of-pocket costs. So whereas Medicare does not have a max out-of-pocket, every Advantage plan will. The coverages, convenience, everything is all in one plan. Plans include your prescription drug coverage. So like I always say, if you have an employer plan, you know, it's going to cover everything for you. You're used to everything being all on one card, and that's the same situation with the Medicare Advantage plan. Coverage is often limited to a service area unless it's an emergency. So, you know, you're going to have your networks that you have to abide by, which again, under your current coverage that you have right now, you have networks as well. But if you're traveling anywhere in the US or again, even out of the United States, emergency care is always going to be covered. Some plans may require you to see doctors and hospitals that are included in their network. Some will allow you to go out of network and still have cost sharing. And they may offer additional benefits that are not covered by Medicare. Different plan types, so an HMO, again, those are the plans that will have their network that you would need to remain within. A PPO plan is where they will have their preferred providers, which is their internal network, but then they also will have physicians that are out of network. You'll just pay a higher cost to see those physicians. Point of service plans, and then special needs plans. So the dual special needs, the slides previously where we discussed if you're eligible for Medicare, Medicaid, again, we call those dual special needs. There are Medicare Advantage plans that are for individual with chronic health conditions, for somebody who is in an institution like nursing home stay, and institutional equivalent special needs plans. Additional plans are PFFS, what we call private fee for service or medical savings accounts. These two plans are not that common in Ohio, more common in other states, but still required to review them. Things that are good to know about the Medicare Advantage plans is you cannot be denied coverage. So choosing the route of a Medicare Advantage plan, there are no medical questions that you would have to answer. You do need to be enrolled into Medicare Part A and Part B and live within the plan service area. Since it is network-based, you have to continue to pay your Part B premium. You may be required to use a provider or pharmacy within their network. Coverage and costs vary by plan, and they may change from year to year. And every plan has an annual limit out-of-pocket costs for covered services. So Part D, prescription drug coverage. It helps with the cost of prescription drugs and some vaccines. It's only offered through private insurance companies. Medicare themselves do not cover prescriptions. You must continue to pay for Part B. They reiterate that regardless of what you're doing, you're always going to have to keep your Part B in place. Two ways to get the coverage. You can get prescription coverage on its own, a standalone basis, or through enrolling with the Medicare Advantage plan that also includes prescription coverage. Medicare Part D plans cover type of drugs most commonly prescribed for Medicare beneficiaries as determined by federal standards. Specific brand name drugs and generic drugs included in the drug formulary. This formulary can differ from plan to plan, so it's important to look at those before you enroll. Commercially available vaccines not covered Part B. So there are some vaccines that are covered under original Medicare Part B, and then there's other vaccines that would be covered under a prescription drug plan. Every carrier, every plan is going to have a formulary. So a formulary is a list of drugs that are covered by the insurance plan. Many plans have a tiered formulary where drugs are divided into groups. In general, the lower the tier group, the lower the cost. So tier 1 is going to be your generic drugs that are more widely prescribed. Tier 2 are still generic, but not as often prescribed. Tier 3 will be your brand name drugs. Again, most often prescribed. Tier 4 would be your less often prescribed brand name drugs. And then tier 5 will be specialty medications when you're looking from one plan to another. That's pretty typical across the board. Coverage is not automatic to get enrolled into a prescription drug plan. That is something that you would have to choose when you are eligible. Penalties may apply if you enroll late. Each plan has a list of drugs that is covered, and the list of drugs can change each year. Coverage varies from plan to plan, and benefits can change each year, which is important to review that as you get enrolled and as your needs change. It's always important to take a look at those. Part D plans have 4 coverage stages. So you have an annual deductible, initial coverage stage, your coverage gap, and then catastrophic coverage. I think the next slide will give us a little graph, which is a little bit easier to follow. It is the amount of money you pay, changes depending on the stage from one stage to another. Many stay in the initial coverage stage for the entire plan year. This will all be determined based on what type of medications you're taking. So here is the little chart. So you have your deductible phase. The deductible varies between Medicare drug plans. The max deductible can be is $505. Your initial coverage stage is once you pay your deductible, you then go into copays based on the tier of your medication. And then to fall into the coverage gap, that is when the cost of all of your medications equal, and this is retail cost of your medications equal $4,660. If that happens, you then fall into the coverage gap or the donut hole. And that's when you would, if you fall into the donut hole, you then will be responsible to pay 25% of the cost of your generic medications and brand name medications. So if you are in the donut hole, you then will have to, the max limit that you would pay is $7,400. Then this $7,400 also includes that $4,660. It is not an additional $7,400 above the $4,660. But getting into the initial coverage stage is the retail cost of your medication. To get yourself out of the coverage gap, it is the 25% that you pay that is accumulated. And then if you do end up incurring that $7,400, you then are in catastrophic, and then you will pay minimal copays for the remainder of the year on the cost of your medications. Medicare supplemental plan, so this, or a Medigap, this is your second option to Medicare. It helps pay some of the out-of-pocket costs not covered by Medicare's Part A and B. It works with original Medicare and Medicare Part D. Plans are offered by private insurance companies in your state. Plans are labeled by letters. Costs and covered services vary by plan. Plans with the same letter offer the same benefits nationwide, except for in the states that are highlighted, as those are standardized plans differently than all other states. The supplemental plans will help pay your Part A hospital coinsurance, Part A skilled nursing care, your Part B coinsurance or copays, cost of blood transfusions, cost for 365 extra hospital days. So that's above and beyond that 150, that extra extended days under Medicare. So you get a little bit more under a supplemental plan. Hospice care, your Part B deductible. This is different for individuals who became eligible for Medicare after 2020. The Part B deductible under a supplemental plan will no longer be covered. So you're responsible for that initial Part B deductible. A supplemental plan will pay for your Part A deductible. Cost of foreign travel, up to plan limits, provider charges above Medicare's approved amounts. So if you go to a provider who doesn't accept Medicare, if they if they bill you in excess charges, your supplemental plan may still cover that for you. Plans do not help with prescription drugs unless if it is a prescription that is going to be covered under Part B. If it is under Part B, your supplemental plan will cover it. If it is something that is covered under Part D, then the supplemental plan cannot pick it up, which is why you would want a standalone prescription drug plan. Supplemental plans do not cover routine dental, vision, or hearing, like eyeglasses, contacts, hearing aids, custodial care, long-term care. So I always say, if it's something that Medicare will approve and cover, your supplemental plan is going to cover that deductible or copay for you. If it is something that Medicare will not cover for you, then your supplemental plan cannot either. And then here's a little chart of all the different supplemental plans, Plan A through Plan N, and then depending on the different plan that you choose, it will determine, what is covered, what is not covered. So for example, Plan A and Plan B, it does not cover skilled nursing care, where you have Plan K and Plan L, where it will cover it at a certain percentage across the board, but then there's certain things that it does not cover for you. So if a supplemental plan is something that you have or that you're interested in, then you would want to make sure that you're looking at which plan you're choosing and which lines of coverage that it's insuring you for. And then your coverage choices. So again, just kind of reviewing that, you have Original Medicare, which is going to give you your Part A, which is your inpatient hospital care, and Part B, which is your doctor visit and outpatient care. So your first option is doing the Medicare supplemental plan, pairing it with a standalone prescription drug plan, or the second option where you just kind of put it all together into one plan, which is referred to as either Part C or Medicare Advantage plan. It means the same thing. And then again, an Advantage plan is going to take your A and your B, and then most plans then will also do the D as well, all under one plan for you. So Medicare enrollment. So how and when can you enroll? October 15th through December 7th is the annual enrollment period. So this is for individuals who are already enrolled into Medicare. This is your time to kind of review where you're at, what you have, how it may be changing for the next following year, or if there are certain circumstances that have happened throughout the year that would require you to review and compare what your current plan is. That is the time that you would want to do so. And then if you do choose to make a change, that change then would take effect on January 1st. Your initial enrollment period is for those who are soon to be turning 65. Your initial enrollment period is going to actually start 3 months before your 65th birthday. So 3 months before you turn 65, you can start looking at what your options are and making a decision on which option you would rather go with, a supplement or an Advantage plan. But if you don't choose the 3 months prior, you also have the month that you turn 65, and you also have the 3 months after you turn 65 to make a decision on which option you would like to go with. And if you're delaying it 3 months, there's no penalty. If you do not have a secondary plan and you just choose to delay your enrollment into Medicare after the 3 months, that's when your late penalties will start to incur. And then special enrollment period. So if you're losing employer coverage, if you are moving from one state to another state, or if you're going from one county to another county, because the Advantage plans or the prescription drug plans are based on the certain counties, you could find yourself in a situation where you're still in the same state, but going from one county to another, and now you're losing your coverage because the plan that you're on is not offered in the county that you're moving into. And then there's some different other special enrollment periods that could potentially trigger your ability to enroll or change a plan that would be outside of the annual enrollment period. Late enrollment premium penalties. Delaying Medicare Part A, there is a penalty is 10% of the Part A premium. No penalty if qualified for premium free. Again, if you're going to, for whatever reason, delay enrolling into Part A and you don't have credible coverage, that's when these penalties, not just for Part A, but across the board, would kick in. So Part B penalty is 10% of the monthly Part B premium amount for each full 12-month period enrollment is delayed. So for every 12 months that you delay that, you're going to have a 10% penalty. No penalty if qualified for special enrollment period. So for example, if you are working and you delayed enrollment into Medicare Part B because you are on your employer plan, there's no penalty because you didn't take Part B. You had credible coverage. So this would not apply to you. And then Part D, penalty is an additional 1% of the average Part D premium for each month enrollment is delayed. No penalty if less than 63 days without credible coverage. So again, if you have credible coverage and you did not enroll into Part D, there's no penalty. But if you go more than 63 days without credible coverage, every month that you go without credible coverage, you then will pay that 1% of the national average cost of a standalone prescription drug plan. And then these penalties across the board, it is not a one-time payment, it is a lifetime payment. So it might seem minimal, when you're just looking at it, but then extrapolated across the remainder of your lifetime, it might not be worth taking those penalties, but everybody's situation is different. And if I would then just suggest, discussing your scenarios with the specialist who could best advise you on which way to go with that. So changing coverages. When can you change coverage? October 15th through December 7th is the annual enrollment period. This is when you can join, switch, or drop a Medicare Advantage plan or a Medicare Part D prescription drug plan. Switch from original Medicare over to a Medicare Advantage plan or vice versa. Switch from one Advantage plan to another. Apply for a Medicare supplement insurance plan. So, you can, anything that is going to have, your Advantage plans, Part C or prescription drug plan, this is when you would want to, if you want to go from one plan to another. What's not listed is a Medicare supplement. If you are in a Medicare supplemental plan, you can change your supplemental plan to another supplemental plan any time of the year. That's not locked into the annual enrollment period. However, if you're on a supplemental plan and you want to go into an Advantage plan, this would be the time frame of when you would want to do that. Or vice versa, you're on a Medicare Advantage plan and you now want to get into a Medicare supplement, you would have to wait until the annual enrollment period to be able to do that as well. Medicare also has open enrollment period, which is from January 1st through March 31st. And this is typically for those individuals who have a Medicare Advantage plan only. You can switch to a different Medicare Advantage plan or go back to original Medicare. You can enroll into a standalone prescription drug plan if returning to original Medicare. Only one coverage change is allowed. So during the annual enrollment period, again, from October 15th through December 7th, you could put as many plan changes in as you want during this time period. Whatever the last application that you put in by December 7th, that is the coverage that will remain in place starting January 1st. The open enrollment period, which is at the beginning of the year, January 1st through March 31st, if you need to make a change for whatever reason during the annual enrollment period, you weren't able to review your benefits, and now during this time frame, you realize that there is a plan that would better suit you, you can do a one-time change from your Advantage plan to another Advantage plan. Or if you decided that you would prefer to go into original Medicare and potentially pick up a supplemental plan, they will then allow you to pick up a prescription drug plan so that you could remain compliant. Changing coverage, special enrollment period, or qualifying life events 2 months after the month of the qualifying event. So an SEP, special enrollment period, to make plan changes is available for 2 full months after the month of a qualifying event. Again, things like changing your residence, leaving a retiree plan, a union, or COBRA coverage, join, change, or drop a Medicare Advantage or prescription drug plan outside of the Medicare annual enrollment period without penalty. So this is just saying that you could pick up these plans within the 2 months of a special enrollment period, and no penalty is applied for those. Your cost savings, cost saving tips, make use of your preventative services that are available to you. Obtain services in your plan's provider network. Inquire about generic or low-tier prescription drugs, and that would be with your physician. Take advantage of using your plan's preferred pharmacy network, or consider using mail order when filling prescriptions, especially on brand name drugs. Depending on the pharmacy, or using mail order can always make a difference on your overall cost. Understand your status in the hospital, inpatient versus observation. And this is important for individuals who go the route of a Medicare Advantage plan, because if you are in a hospital bed, but you are being kept under observation, this is considered outpatient, which is covered under Part B, versus it being covered as inpatient. There's things that have been put in place that the hospitals are required to advise a patient on how they're being treated, whether it's inpatient or outpatient, but it's still important to kind of try to remember to ask that when you're in that situation. Check available financial assistance programs. There are extra help programs for the cost of helping to reduce the cost of medications, Medicaid, Medicare savings programs such as PACE, which will help provide individuals with additional resources just above and beyond helping with medical costs. If there's anybody who needs these assistance or has questions on them, please feel free to ask. There are a lot of different resources that are available out there. And then your next steps. So next steps: 1, review your enrollment periods and understand what scenario applies to you specifically. Research your options, because there are definitely many options that are available out there. Ask questions, get your answers, find financial help if eligible, enroll, yearly review. This I think is really important, just because there are always changes within plans. And you know, it's always best to be aware of what's available to you. And if at the end of the day, that means that the plan that you have chosen this year is still the best plan for you next year, then I just think that that's good to know. I think that, you know, that'll make you feel confident going into the next year that you're insured in the way that you would need to be. And then additional resources that are available. Medicare.gov has wonderful information just on the basics of Medicare. Reviewing or researching different plans that are available as well. The Medicare 800 number. This website has a lot of great information as well, or your state health insurance assistance program, which is your job and family services, Medicaid. Also, it's not on here, Social Security has that extra help program for prescriptions. That's another resource that you can speak with them to see if that's a resource that could be advantageous for you. And that and a mouthful is pretty much our presentation. So we will open it up for questions and go from there.
All right, I'm gonna pull up our slide here for contact info and give everyone a moment. We've got some fantastic questions that have come in. I'm gonna give anyone else who's got a question just another minute to get theirs in. We will be taking a screenshot of the questions from the Q&A. So that way, and I'll read these out loud as well. So this way everyone can see what the questions are asked. There's some really good ones in here. And I also wanted to make sure that everyone knew we will be sending out an email by the end of next week with a link to the presentation as well as the slides. So these will all be available to you. And if you have any follow-up questions, of course, you can reach out to us at any time. And Rodika is just a fantastic resource. So please feel free to reach out to her. All right, let's move into the Q&A portion. Let me minimize this just a little bit so I can see everything here. One note I wanted to make prior to getting into the Q&A, just something to add for posterity is a note on the Medicare Part B coverage with what counts as income. And Rodika, correct me if I'm wrong. I believe they look at brackets for modified adjusted gross income in determining the premium each year. And that's something that's very important to be aware of. I had a client years ago who had a legacy stock position, and he thought, I'm retired now. It's a huge capital gain, but I'll pay the taxes out of my the proceeds of the sale of the stock. No big deal. He goes and sells the stock for a tremendous capital gain, and then he goes to find out that increased his modified adjusted gross income to such an extent that their Medicare Part B premiums increased, and that's for a full calendar year. So right. It's very important to keep that in mind with your tax planning. The brackets are pretty generous. They do adjust each year for inflation, but it's something certainly just to have your eye on, especially if you have any type of significant capital gain.
Right. Yeah. So like something that I say is that anything that you are going to have to claim on those taxes, that is going to be included as income. And then whatever that income amount is, that technically follows you for 3 years. So Social Security or Medicare will look at your last 3 years of earnings, and that will determine what your Part B premium is. And then there's ways to try to reduce that thereon after. But yeah, it's something to really be aware of.
Very good. All right, I'm going to go from the top down with these questions that I'm seeing. So this first question, it looks like this pertains to Medicare helping to front the cost of sort of like long-term care. But they ask, what if you are in and out of the hospital multiple times, not consecutive, but over 60 days in total? How does that affect the Medicare fees or premium?
So it's not going to hit your lifetime reserve days. It's just the way that you incur those days will depend on what your deductible or copay will be. So if you end up in the hospital 3 times in 1 year, and it is, one stay is 5 days, average hospital stay is 3 to 5 days. Second time it's 3 days, and then thereon after, let's say the last time you're actually in for 90 days. The first two inpatient hospital stays will be covered under your initial bracket, which is that initial $1,600. And so that's the first 60 days. And then the last day, if you're in there for 90 days, you have the first 60 days, which is covered under the $1,600 deductible. And then the remainder 30 days, you're going to pay that initial copay. So hopefully that answers the questions. You're not in consecutively long enough to be clicking in over to those lifetime reserve days. So they're not counting every single day that you are in the hospital and saying, well, once you hit 150 inpatient hospital days, we no longer will pay. It's as you are in inpatient hospital stay consecutively. And if you have one hospital stay that clicks over to those lifetime reserve days, how many of those days did you accumulate? And then once those accumulated over the additional days, then they won't pay anything thereon after. It's really hard to, I've been doing this for a long time. I have never had a client who has gotten to those days. I'm sure that anything is possible, but those lifetime reserve days don't get counted just as your typical inpatient hospital days. Hopefully that answers that question.
Thank you. All right, the next question. Medicare skilled facility coverage is full coverage days 1 through 20 as long as you meet skilled care qualifications. PT rehab with daily improvement after a knee replacement. If someone needs an SNF, I am not familiar with that acronym, but this person knows what they are talking about. The question is, has this changed? Days 21 to 100 is covered at 80%, and the co-insurance or Medigap insurance could pay only if the person meets skilled care criteria. 100 days of medical coverage in skilled nursing facility, SNF. Skilled nursing facility is not automatic or guaranteed. Skilled criteria needs to be met. Has that changed? So
yeah, sorry, that has not, was that the rest of the question?
Yes, yeah.
Okay, that has not changed. So whether you have a Medicare supplement, or I should say, whether you have original Medicare and then a Medicare supplement associated with it, or a Medicare Advantage plan, Medicare and those under a skilled nursing, that initial 20 days where Medicare covers it in full, there's no cost to the individual for those initial 20 days, regardless of what type of secondary plan that you have. But the stipulation is, regardless of within those 20 days, and even after those 20 days, you have to be making constant progress. If at any point in time, the therapist that's working with that individual determines that progress has been maxed, or there's, or you cannot make any more progress, you are where you are, then your coverage can stop. So Medicare can determine to no longer pay for that skilled nursing care. And then at that point, you either say, I'm not ready to go home, and then you self-pay. You could always put in and work with, a caseworker and appeal that. And I've had clients who have done that because they weren't ready and then they were reimbursed. But the biggest stipulation is you have to be making constant progress for any of original Medicare or a Medicare Advantage plan to agree to continue the care and cover those costs for you. But if you are, let's say, still making the progress and you reach that 100 days, regardless of if your insurance is paying or not, Medicare then thereon after the 100th day will not cover that. And then that becomes a conversation of nursing home stay.
Gotcha. So this is why it's probably important, if you have like a long-term care insurance policy, you want to be mindful when you're, with your elimination period, or let's say if you're looking to get a policy, you want that the elimination period to start probably after Medicare would cut off, maybe not so far because that's an out-of-pocket time.
Right, yeah. Mm-hmm.
All right, another question. Are Medicare Advantage care options limited as to what type of care and where you can receive your care? Is pre-authorization required when while in network and or out of network?
So every plan is going to have their networks. I would say that within just our Ohio region, you have many carriers that have all hospital systems or most of your big hospital systems associated with their network. So it's very difficult to find yourself outside of a network when you're at home. That's not necessarily the case if you are somebody who travels a lot and needs access to networks outside of Ohio. There are some carriers that have nationwide networks, so those carriers would be important to look at that. There are, for certain tests, MRIs, CAT scans, PET scans, a lot of carriers are going to require, if you're on the Advantage plans, will require a prior authorization. But that's pretty typical, even with a private insurance plan, a group plan. If you need an MRI, you're going to need to get a prior authorization before that would be covered. Anyhow, most of the time, the provider is able to get that prior auth before they can even schedule certain testing. Obviously, if it's an emergency situation, those prior authorizations are not required. Did I answer that whole question?
I think so.
Okay, I know there was networks and then different things that would be, yeah, okay.
Yep. All right, another question. If you currently do not use prescription drugs, but in a few years you need them, do you need to sign up for prescription drug coverage now to avoid a penalty later?
Correct. Yeah.
All right. Want to plan ahead.
Yeah, and I would always say you never know when you're going to need medication. So, to not have it, I would say you'd rather have it and not need it versus need it and not have it, and then you're not exposed to that penalty. And there's so many different plans that are available to keep you credible. So yeah.
The next question, if you are covered under a work plan with greater than 20 employees, can you sign up for Medicare Part A and not Part B?
Yes, you can. And that's, if you are not collecting Social Security, enrollment into Medicare Part A or B would not be automatic. So if you are still working and your employer plan is the way that you are going to go, then you would want to reach out to Social Security to enroll into Part A. They'll then send you a card that just shows your Part A, and then whenever you decide to trigger your enrollment into Part B, then you'll get an updated card.
Okay. And then along, just as a follow-up to that, if let's say someone is covered under their spouse's work coverage, they would want their spouse, so let's say their spouse is continuing to work, they would want their spouse to make sure that not only is their current work plan creditable, but there's also a provision that extends to spouses, so that they aren't penalized for not enrolling in Medicare? Or is it just as long as their spouse's work coverage is creditable, they're both okay?
Yeah, so as long as the coverage is credible, it doesn't matter how you get it. If it's through your employer, if it's through your spouse's employer, as long as it's considered credible coverage and you can delay your enrollment into Medicare Part B without penalty. And that's if it has more than 20, there are more than 20 employees. If there are less than 20 employees and you do not enroll into Medicare, your plan will only pay considering that everything has been billed through Medicare. So you'll be responsible for what Medicare should have been covering. And then your secondary plan, which is the group plan, then would kick in. But if it's over 20 employees, again, it doesn't matter who the policy holder is. You can choose to delay Medicare.
Okay, great. Along the lines of the penalty discussion, this next question is the 1% penalty calculated at 1% each month, or if you delayed for 12 months, is the penalty percentage 12%?
So it is 1% of the cost of the national average cost of a standalone prescription drug plan. And then for whatever that equates to, it then would be multiplied by the number of months that you went without coverage. So if if it was all in one calendar year, then it's that penalty amount times 12. If it is, mid-year, so six months in 2023 and 6 months in 2024, the first 6 months you will pay the penalty, that percentage off of the cost of the national average cost of a prescription drug plan for 2023, because all of that changes. So then for 2024, whatever the national average cost is for that, that you'd pay that 1%, and then they would multiply it by the number of months that you would go without credible coverage.
Okay. All right. The next question regarding this is regarding the inpatient versus outpatient / observation. How long can a patient stay under the observation bed period? For example, number of hours, number of days.
They can, that's up to the hospital. I think that they have 72 hours to either admit you or release you. And then, but the hospital would make that determination. Medicare does not have a required time frame of when a hospital needs to make that decision on the care.
Okay, so someone could go in and they hope that they get the inpatient coverage, but if they start off under observation for a period of time, they may not be, like, they could still be covered.
Yeah. Yeah, it's just under what scenario, under what umbrella will that care be paid as. Obviously, it's easier to pay just, a flat amount instead of, because that when you're in observation, everything is being billed outpatient. So if you're having blood drawn, if you're having x-rays, if you're having scans and what have you, all of that is individual. And so depending on what kind of secondary plan you have to Medicare, that can really, change what your total out-of-pocket cost would be. But I think that the rule with the hospitals are 72 hours and making that determination that if they can't get you to the point of needing to be released, they then would have to officially admit you.
Okay. All right. 2 more questions here. One, a confirmation question. So this person says, I thought that once you go to Medicare Advantage, you cannot switch back to original Medicare. However, you shared that you can switch back during, I think was that January enrollment period. So that is correct.
So you can under either scenario, so under the annual enrollment period, which is October 15th through December 7th, or the open enrollment period, which is January 1st through March 31st, you can go back into original Medicare and pick up a supplemental plan. You will have, depending on how long you have been in a Medicare Advantage plan, potentially will determine if you would have to answer medical questions. So if you have been in a Medicare Advantage plan for more than 12 months, to be able to get into a Medicare supplement, you would have to be able to answer that carrier's medical questions. And if you can help qualify, then you absolutely can make that change. It's just that at that time, the medical questions with that carrier would have to be reviewed and determine your eligibility.
Okay. All right, and then last question, requesting confirmation. If I choose to go with a supplement, do I need to apply for Medicare Part D? And he wants to confirm supplements do not include prescription coverage. Is that correct?
That's correct, because a supplement is going to supplement original Medicare. And since original Medicare does not cover prescription drug coverage, a supplemental plan cannot either. So then you would, for all intents and purposes, have 3 different cards. You would have your original Medicare card, your supplemental insurance card, and then you would want to pick up a standalone prescription drug plan. So then you would have a card for that as well.
Okay. Wonderful. Well, I think this answers all of our questions. As we'll be, sending out a link to this presentation along with the slides, and we have our contact info here again. If you have any questions, feel free to reach out. And I'd like to thank everyone for attending today. We've got fantastic questions, very thoughtful, and thank you, Rodika, for taking the time
Yeah, absolutely. It's my pleasure.
and sharing your insight. All right, wonderful. If there's anything else, again, feel free to reach out to us. Otherwise, we hope you all enjoy the rest of your summer.
Thank you.
All right. Take care, everyone.
Bye-bye.